Hello, I'm Dr. Ruth Roberts, your pet's ally. Hope that you are all having a great day. And we have a bunch of questions, so let's just jump right in. Uh, First, May is asking about spirit and melatonin. And so May, you could give up to 10 milligrams a day. So you could take them up to 5 milligrams twice daily. And then coupled with that, and I'd kind of forgotten about these products, but you were asking about Composure for small dogs. In my hands, this never worked that well. The theanine was, sort of the active ingredient there. There was another product we used in the practice called Composure Pro, and the difference between it and the theanine are a dosing of the regular Composure is that the theanine dose is doubled in some change, and then they added in tryptophan. And frankly, I think this is what made the best sense of all. Now, you correctly point out that because these are chews, they've got a bunch of crud in them that really, is not useful, especially when you're trying to go through a rotation and elimination diet. And I'm sorry, Haya was super barky today because there were multiple weddings and fireworks and things over the weekend. So she's all hyped up. So yeah, so we've got barley, brewer's yeast, maltodextrin, and then chicken flavor, oat flour, all this junk that really is not going to be of much help. So what I ended up using in practice was liquid Nutri-Calm. And the tryptophan dose is, kind of spot on for what we're after as far as there's 75 milligrams and 25 milligrams of theanine. And then also ashwagandha, which is um, an herb that helps you balance your system out a bit better, and some valerian root for more sedation, and then a little bit of calcium and magnesium. And then for pets, the catnip can be sedating as well. So, this is in water, fructose, glycerin, natural salmon flavors. So as long as salmon is not an issue, it's not a big deal. The only downside is it does have some xanthan gum in it, which isn't great, but frankly, for the majority of my patients that had food sensitivities, they really did well with this. And so I'd encourage you to take a look at something like this because you can work this into what you're doing on a regular basis to help spirits sleep at night. So let me put that in the comments for you, but I think you'll find this to be a better product. That dose is per 2 mLs. We had a dog, Sam, that was a Brittany Spaniel. He was about 40 pounds. He took an ml twice a day because he just was so anxious all the time, and especially with thunderstorms and things like that. With the Nutri-Calm, and he also had some back issues, a little bit of gabapentin for the pain, and what else did we give Sam? I think that was really it. We were able to get him, I think I gave him fluoxetine at one point, but using this and then keeping him calm and getting him into his little happy spot when there were thunderstorms, we were able to get through a lot of things without, and finally we were able to get rid of the fluoxetine. So I hope that makes sense. And let's see, the other things I wanted to show you. So I think that I would add that in or something like that, Pam. You can find human products as well that have those ingredients, but I would look for the tryptophan and theanine. And frankly, I think the valerian root worked really, really well. Good. Yeah, the rescue remedy, I would say maybe, and and I think others have had better success, but from seeing so many of my clients try it, I would say maybe 1 in 100 dogs responded to it. Um, the Chinese, excuse me, flower remedies, if you can get a couple of drops on his tongue, that would be a great way to do it. You could also, um, sort of pull the lip out and drop a little bit in and see if that goes, because really that's just getting the idea there. Also, you can rub it over his head, although or spray them. That's the other thing that the folks at Glacier Peak Holistics were doing with their flower remedies, was spraying it on both the dog and the person. So let's see, let me pop back over here. So I hope that helps me. Um, and then you're asking about the bye-bye dog breath. Yes, leave that out of the rotation until you can verify that things are okay or not okay. And then this is where it gets really tough with dental stuff for pets. Um, yeah, that's a great idea, Jamie. Thanks. So she says that you can um, just put the rescue remedy and that kind of stuff on a spoon and then let them lick it up. And often they will, so that's a great idea. Now, so what do you do about dental care if you can't use any of the flavorings? And this is where I wish they still made pantyhose, because what I used to tell people is, put a piece of pantyhose over your finger and then put that in the dog's mouth doing this number, you know, physically just kind of doing stuff around. The other alternative would be something like a gauze square, um, or any type of like a piece of something like a microfiber cloth that's got a little texture to it. And then you could use things like dampening it with a little bit of peroxide. And that actually helps to kind of kill the bugs, and see if that will go down without a hitch. Many of the dental products for dogs are usually something like calcium carbonate. Andrea's got a great formula, but unfortunately it does have chicken flavoring in it. So I would try that, just some physical rubbing on there. So Next question is from Sherry, and she is asking about pain control. And her dog, Bella, did not do well with CBD, because it either knocked her out or really didn't do much for her. So that kind of stinks. Meloxicam, if she is having a super bad day and there's no issues as far as horrible kidney enzyme elevations, things like that, I don't think that's a bad thing to use. Um, so if CBD is not an option, gabapentin has been helpful, but most veterinarians tend to um, go with a super high dose of gabapentin. And so sometimes this can actually be sedating, and that may be part of why you're not seeing an increase in energy. And then, as Bettina says, she is a big proponent of the Assisi Loops because she's worked so well. Tea relief can make a huge difference as well. So those you can get to use topically, and you can also get them as a tablet. But those work extremely well. You would give something like, for Bella, if I'm remembering correctly, Bella was somewhere around the 20-pound mark, and if that's not right, you can shout it out. But just use the human ones, and come here. And I would try something like a half a tablet twice a day, but it's an arnica-based thing that's been very helpful. There's a whole host of other things as far as um, enzyme products and uh, and I'm sorry, I'm struggling for the word. Uh, that help reduce inflammation, and then revisiting other anti-inflammatory products like curcumin, things of that nature. I mentioned to you all I was trying PEA for myself, and I have to say, unfortunately, this was not very successful. It looked like um, it should work really, really well. But for those of you that can't remember, it's a version of, let me pop this up here, phenyl, yeah, palmitoethylenolamide. That's why I can't remember the name. So I was trying this at 1,200 milligrams, which is the twice daily, which is the dose they had suggested in a couple of papers for people with fibromyalgia. And unfortunately, it just was not very effective. So I wanted to pop that back in, but I would definitely, Sherry, look at an Assisi Loop. We do have them available on our website now, so I'll drop this in here. This is the smaller one, which I think would be appropriate for you. I can tell you that the larger 20 centimeter version is on back order for a couple of weeks, although it should be coming back in stock pretty quickly. So let's pop back over, make sure I'm getting everything covered here. But yeah, there's a ton of things. The acupuncture is wonderful, massage, and then again on the website in the members area, there are videos on basic Tui Na techniques. These can be helpful, and then just all sorts of things like ice over the area. Sometimes warming is better for them, so you'll have to kind of check that out. And then Kathy was asking about twitching when they're sleeping, and Erin gave you the exact answer I would give you. Generally, seizures happen when they are awake. They can have a seizure in the middle of the night, but generally it's going to be something you can't rouse them from. They just, they just are literally, they're dreaming and having some issues. If it's something that's changed recently and it's become worse, it may be that there's some sort of imbalance in the diet. But majority of these guys are just dreaming, which is easy. And then Mr. Willie, come here, you little barking fool. Poor buddy. So little urine leaking, and then yeah, and Jamie, I would go with Poly-MVA for him first. Yeah, I really wanted it to work, and unfortunately it didn't, because that would have been wonderful. But these poor little feeties, um, I mean, this looks like either a possible drug eruption or a possible infection. And then the other thing, if your oncologist didn't seem to know what they were, then that makes me a little less worried that they're unfortunately cancer lesions. Let me make sure I'm reading this all correct. So either a drug eruption or, he's just kicking something out of his system. How's he doing in general? His lesions, I know they're getting worse off of the doxorubicin, but are these starting to kind of clean up a little bit? Are his little feet getting better? I mean, we can see cancer go to really, really strange places. I had a dog with a fibrosarcoma, and it ended up metastasizing to his tongue, poor buddy. So, well, I'll let you think on that for a minute. And then May had another question. Actually, she talked with the folks at Glacier Peak and was not super impressed, but glad to hear they weren't pushy. But they suggested probiotics and enzymes to be used right away. Yeah, and I would kind of hold off on these so that you're clear about what's what. But let's look at a couple of these options that they're presenting you with. So the probiotic is this one, and frankly, I'm not super impressed with it. And again, this is where uh, I would use something like Megaspore Biotic because this is not, it does not have any flavoring or anything like that, and I've just seen it be um, a lot more effective. And the other one they suggested, the digestive enzymes, um, is not a bad product. The one thing I don't like very much is it's in maltodextrin, which is a sugar that can create some inflammation in the GI tract. So you've got a proprietary blend of protease, acid proteolase, amylase, cellulase, hemicellulase, glucoamylase, lipase, invertase, maltase, all this good stuff. But you kind of don't know how much is which. Another option you might consider would be Zypan, which is Standard Processes products. Um, and again, we're in a proprietary blend, but there's betaine hydrochloride. So we're starting really from the top down. So hydrochloric acid in the stomach, bovine pancreas-cytosol extract. So we're going to help support the pancreas to do a better job at making a lot of the pancreatic enzymes on its own, and then pancreatin, which is sort of the active ingredients from the pancreas, and then ammonium chloride, which will help balance the pH, and then bovine spleen and ovine spleen. And so again, this idea of like feeds like, where the spleen is the main digestive organ in Chinese medicine, is kind of where this idea of adding spleen comes from. So let's see. So I hope that is helpful, May. Let me make sure I got all of that question. But I would just take it, a step at a time. And again, the Zypan at this point, not a great choice because again, we've got, yeah, I would wait on these for a few weeks because you've got bovine spleen and ovine spleen in there. There's a couple of other products out there, but and I'm experimenting with a new one that hopefully we'll get in a couple of weeks for Hio and Mary Jo and I called NSAID, that's made by a company called Endomet Laboratories, and this is the company that actually does the good. This is the company that does the tissue mineral analysis for us. So, so Pam, yes, wait a few weeks on that, and that's why the Chinese medical doctor was working on his spleen and the healing, because that's the main digestive organ. So check that out. The other one is Zymex. Whoops. So sometimes, I don't know, I think everybody says everybody needs digestive enzymes, and I don't know that I really agree with that. But there's another approach where you can encourage a healthy intestinal environment to support the microbiome and also create the optimal intestinal pH throughout the length of the tract. And again, these would all be good. I think that he had some sensitivities to carrot though. Although correct me if I'm wrong. So that's another option. And then I'll let you know how the NSAID goes. And then Jamie is saying that he's doing okay. He's got some new lesions and lots of damp. But some of them scabbed up and fell off this weekend, which is encouraging. So she started spraying his paws with povidone this weekend and dermacleanse. And one nail is kind of coming off. Okay, and the paws started getting bad on doxorubicin. So, maybe it is a drug reaction and he's kind of clearing things out. The other thing you could consider doing is just doing good old-fashioned Epsom salt soaks because, yeah, that's what I thought, Pam. Because that will draw, like if you make it a tepid solution and put something like, if you've got let's say a half a gallon of water and put in something like a quarter cup of Epsom salts, um, then, tepid water, and then just let him, if he'll leave his feet in there, great. If he won't, the next best thing is to take like a hand towel and soak it, squeeze out the majority of it so that it's still pretty damp, but it's not dripping all over the place, and just wrap his feet up in that. And he may think that it feels really good. So that'll draw a lot of that grossness out of there, and then you can kind of, um, use some dermacleanse or something like that, or povidone, or actually some of that CBD ointment, but that's such a lot of area to cover. Um, so I would just do soaks. You can add some povidone into that Epsom salt mix and kind of kill a few birds with one stone and see if that doesn't help dry things up a bit. Okay, so Carrot is okay. So yeah, so Pam, check out Zymax and see if that makes sense. And I think that's it. Any other questions from you all? I think I did mention last time I'm gonna do a presentation on medical cannabis for pets, which Pam got to see, but this one will be sort of um, less sciencey, if you will, although not a ton less. And so I'm doing that tomorrow at 1 live, um, and we'll give that a go. And then yeah, try some topical CBD Soothe and put some booties over his feet and see if that helps heal things up. The other thing you could do too, if you'll permit the booties for a while, is to put maybe dilute some of that CBD, even in an oral oil, in some coconut oil, and then just kind of coat his feet with that and see if that helps dry things up. Okay, so hopefully I will be so much smarter tomorrow, and you are, as always, welcome, Jamie. I'm glad I can be of help. And but at any rate, we will see you tomorrow afternoon if you can make it. Then, and actually, Pam, that's a great suggestion. Um, Coconut oil, shea butter, and beeswax. Yeah, we make a similar. There's a lotion bar video we did, and it's coconut oil, beeswax, and cocoa butter, and that seemed to really work well. But any of those things I think are gonna just add some moisture. The coconut oil itself is antibacterial, so it's going to help kill off some of those bugs and kind of seal things off. But you do need to keep cleaning it up. Anyway, so that's what I have for you this week. Much love to you all, and hope to see you tomorrow afternoon, and if not, next week. Until then, give everybody a big hug and a kiss for me. Thanks. Turkey.